20 seconds. So this is hard. It's kind of like posterior glide of the hip. Okay? So you're trying to shear through the SI joint, so try to, well, I try to push as much as I can. For 20 seconds. Okay, you got it. Scoot back to the middle. Can I do one more before we move on, before you guys break up? So the next thing in supine, we have stability tests. The first one is straight leg raise, which is actually a straight leg raise test. And it's going to load the SI joint, so it's a little bit easier than the standing functional test, right? So with this one, I'm going to have Leith go ahead and lift this leg up and down. This one and down. He's pretty good. Okay, so what I'm looking at here, a few things. Again, check the resting symptom first. As he lifts his left leg up, he's loading that left SI. Okay? But it requires the stability of the entire osseous plane, right? The other side, the pelvic, lower muscles, and all that. So you're looking for, can they lift the leg actively? One, does it produce their symptoms? Two, and how stable their pelvis is? Or are they just kind of like tilting a lot? He did pretty good. He wasn't tilting. It's much harder than you think. Some of you guys will notice that it's really hard and your pelvis is kind of being tilted. So let's just pretend that it's his right leg and he's not able to lift it or has pain or he just has a lot of compensation with his pelvis. It's not as stable. So then we have to follow it with two different tests. One, you guys remember form closure and force closure that I talked about? Form closure is more passive stability, like the bones, so the shape of the sacrum, the congruency of the joints, the ligament integrity, and all that. So we're going to test this. So basically I'm going to give him additional passive support. So form is passive, force is active for muscles. I'm going to give him that form closure, try to give him passive stability, and see if that changes, if it makes it any easier for him. So my hands are around his iliac crest, or not iliac crest, just like on the sides of the ilium on each side. Then I'm going to trying to squeeze his both ASIS into the sacrum. That's probably the easiest way I can explain. Now I'm going to have him lift his right leg up and then just bend down. And I'm looking at it if it makes it any easier for him to lift that leg by giving him that additional passive support, right? And if it did help, then you can consider the SI belt. We were looking for SI belts and we could not find them. We have them. They're somewhere in the storage. We're going to clean our storage this Friday.